Welcome to Heaven and Health Podcast, your trusted source for insightful conversation on health and wellness and real talks. I'm your host, Angel Polido. In case this is your first time joining us, Heaven and Health Podcast is a podcast designed to inform the public about different certain health problems that we face in our everyday life. And looking on the real estate, this is where we talk about lands and the laws and the regulations that people need to follow when acquiring land, and we even give them the right directions where they can acquire their lands. In each episode, we invite experts who explain in depth on the matter and provide solutions. And today we are shining on the spotlights on women's health. Joining me is the renowned expert in the field, Dr. Jennings, a board-certified gynecologist of years of experience in helping women navigate their reproductive journey health. From menstrual cycles to menopause and everything in between, we'll be discussing in the latest medical advancements, debunking myths, and sharing practical tips for a healthier you. So sit back, relax, and let's dive into today's conversation all about infertility in women. Welcome, Dr. Jennings.
Thank you so much. I think you've already displayed my name. I am a doctor. I will basically work with women on issues concerning the sexual reproductive health. Mostly I deal with men and women, but when it comes to the medical services, women usually are the ones that covers the majority of our patients in the hospitals. So I'm vast experienced because I graduated with my first degree in 2011. So I've been working as a medical doctor since then. Of course, I've done a bit of some topics, but some programs, but mainly it's to do with management. And I have vast experience in terms of infertility and subfertility as a whole. These are my day-to-day topics, and I mainly meet quite a number of individuals coming with the same issues on a daily basis. So I feel very glad to be discussing and sharing issues to do with infertility to the nation, as these are some of the factors that are affecting relationships of our beloved young ones.
So when you talk about infertility, what is infertility?
All right, so thank you so much. When we talk about infertility, we are looking at failure for a man and a woman to conceive in a year of sexual intercourse. That's unprotected sexual intercourse, as well as it should be heterosexual. We're looking at, because apparently we also have the homosexualities in our medistas, but when we look at infertility as a whole, we're looking at a man and a woman, that's heterosexuals, having unprotected sex, that is for the whole of 1 year. We're looking at sex in general, not just sex in general, but we're looking at couples who've been whether they're in a relationship or in a marriage, who are constantly having sexual intercourse.
Yes.
So when it's less than 1 year, we call it subfertility. Most of the times when we look at subfertility, it's about from 6 months to 1 year. After 1 year and then going forward, we call it infertility. That's when there's a failure for a couple to conceive. Yep.
So everyone who fails to conceive is called infertility.
Basically when 1 year elapses after unprotected sexual intercourse, we call it infertility.
What are the most common causes of infertility in both women and men?
So men and women have got different anatomy. So we've got also different causes of infertility as a whole. So we've got the factors that affect men, the factors that affect women, and then the other factors that affect both women and men, and the other factors that are known. So I'll start basically with the factors that affect men.
Yes.
When you look at infertility in general in a man, it usually comes about because of first thing, the duct, the sperm duct in general, which has been occluded. Basically, it might be because of sexual transmitted infections. That also most of the times will make a vast difference to get inflamed, and then at the end of the day, that infection might actually go up until in your spermatozoa, and then later on you might fail to generate enough spermatozoa in order to fertilize an ovum. We also have conditions that might also affect the sperm ducts in general, like for instance, when one is involved in an accident and the sperm duct has been affected. That also is one of the contributing factors. We also have iron deficiencies. Iron is one of the most important factors when it comes to generation of the spermatozoa. So when you've got the iron deficiency diet, or in general your body is deficient in iron, we expect that an individual will also develop infertility. So there might be issues to do with your low sperm count, as well as not even availability of a spermatozoa in your sperm, in your semen in general. So basically, those are some of the factors that affect men. In female, we have issues to do with possibly the cervix. If it's the cervix in general, if the position of the cervix is different, sometimes the sperm might have some difficulties in penetrating into the uterus, going to the fallopian tubes. We also have factors that affect the uterus in general, like for instance what we call endometriosis. Endometriosis is a condition where the endometrium, the lining of the uterus, might not be slowly implanted in the uterus in general. It might be in different areas. Sometimes it can even go as far as the abdomen. So that also affect the fertility in general of a woman. We also have factors like the tumors, the benign tumors, like
cancer?
Not necessarily cancer in general. When we talk about cancer, we call it's a metastatic cancer in general. This one is not a metastasis. It's a benign one. When we talk about a tumor, it's just a growth. It's not basically a cancer in general. It's just a growth. So the growth might be benign or might be metastatic. So we're looking at the benign ones. The most common one is what we call the fibroids in general. Yeah, these are one of the factors that also affect the implantation of the fertilized ovule into the uterus. We also have other factors like inflammation of the fallopian tubes in general, like the sexually transmitted infection, pelvic inflammatory diseases. These also affect the movement of the spermatozoa to fertilize the ovule. And there are other factors that also affect possibly the ovulation of a woman. So these ones, at the end of the day, they might come up with conditions whereby even the sperm has been inserted, has been injected into the reproductive canal, but since the ovule hasn't been produced, then at the end of the day, then we don't have a fertilized embryo that we implant in the uterus. Yeah, due to some other hormonal factors. So basically, these are some of the factors that affect women. And we also have factors that affect both women and men. Sometimes incompatibility itself. It might be possible that a man is fertile, and a woman is also fertile in general. But then the union, sometimes there isn't that compatibility in general.
Like there's no match between them.
Yes. So sometimes people might not produce at the end of the day. Those are the couples that whereby when they separate or divorce, you find that one is pregnant or the other one has also impregnated someone. Yeah, we have living examples of such kind of individuals. And other factors, there are some other factors which are miscellaneous in general. There's some that we may fail to discover what's really causing the infertility in general. So after all several factors that may be there, checked in all those areas, but then at the end of the day, couples are still not producing.
Still not conceiving.
Yes, sure.
So apart from all these factors, does diet contribute to infertility?
Yes, it does. As I already said earlier on, we are looking at iron deficiency. When we have a food that is deficient in iron, or an individual has got iron deficiency, most of the times, especially to a man, sometimes we might fail to produce, and or else when you have a woman who also has the same condition where the iron deficiency, implantation is not solely does not solely transpire. because iron is also responsible for nidation, in other words, implantation of the fertilized ovule to the uterus. So if iron is deficient enough, then obviously there is also factors that contribute to infertility.
All right, before we move further on, after looking into the common causes of infertility in both men and women, how does infertility affect relationships and marriages?
All right, it does. Yes, it does. I also failed to mention. I think I forgot to mention that when you look at globally, 5% of relationship have experienced issues to do with infertility, and contributing factors, 25% to 20 to 30% of on the male side, and 35% goes up to the female side. So
That's large.
yeah, so we're looking at most factors, majority of factors affecting women. So yeah, infertility or subfertility in general affect women and men, or relationship as a whole. When people come to the hospital to seek some medical assistance, most of the times they come simply because they have encountered the relationship is not solely good. So the factors that may contribute to their uncomfortability comes from, first of all, the community in general. In Malawi or in other countries, especially African countries, we expect that when a couple gets married, the second stage is them to have a child. So as the years passing by, people start complaining, start asking questions, a lot of questions on what's really happening. Some will try to offer you some assistance, and coming from the witch doctors or the traditional doctors and all that. That also affects the mentality of the whole relationship as a whole, because what they want is the reproduction in general.
To have children in their family life.
If you don't have children while you're married, that's a community concern. So those factors, starting from the community, they also goes to the individuals as a whole. Because once someone else has experienced some sort of some questions or uncomfortable questions coming from different individuals, that psychological torture will affect your day-to-day living with your spouse in general.
Causing depression.
Yes, it might lead to depression. That's a very good factor. Actually, even the sexual performances in a relationship also decline. People feel like they're doing nothing, even though most of the times the sexual intercourse does not lead to pregnancy. But most of them, initially when they get married, their assumption is that having children is one of the paramount factors that is also engaged in a marriage as a whole. So that factor in relationships are highly affected by fertility or infertility in general.
So apart from those factors that can affect them emotionally, psychologically, how can they cope with this stress from people, from families?
All right, fine. So there are other factors. There are other issues. There are other resolutions that may come about. First thing, when the couple is experiencing issues of subfertility or infertility,
Yes.
The first one is to seek medical attention, because we're there to come up with solutions, to come up with a diagnosis to say what is really the causative agent in this issue. Once we found out that the issue is curative, then obviously the couple might also get assistance. If at all the issue is beyond control, there are other procedures that may come about, like issues to do with adoption. If at all an individual is well-to-do, we can also refer them. Yes, is willing to do that as well. We can also refer one for what we call in vitro fertilization. That is also possible, even though that's not transpiring in Malawi. But we can send someone else abroad. Someone can be referred abroad to be done with this. But we've got couples that have had those issues have had the procedure in Malawi in general. Those people who are well-to-do, they've done that. It's workable. It is something which is a best solution to such kind of stuff.
Yes.
Yeah.
Looking on the myths that are being surrounding in the area, it's either your parents or your grandmother or your other spouses that you have been marrying them in the past. They aren't happy with your marriage, so as a result, they have bewitched you. And others also says that the woman may have experienced a couple of abortions. Are these myths just myths, or they are truths, or What are the myths that are being surrounding in the area?
In general, of course, people talk about one having abortions and then leading to infertility.
Yes.
And that is a good factor. Actually, it's not even a myth. It's one of the issues that also affect. There is what we call Asherman's disease. This is a condition whereby one develops some scars in the endometrium of the uterus. So once sperm and an ovule gets the ovule gets fertilized by a sperm, when they're about to implant in the endometrium, there is that scar which is there, and then that scar will also prevent that fertilized ovule from implantation. So that also leads to what we call continuous miscarriages or continuous abortions, which may or lead to infertility at that juncture. So that one can no longer be put in as a myth. But people talk about issues to do with the witchcraft, someone's womb being tied, and people talk about the sexual positions. Yeah, some of these they may also apply. People talk about there's just lots and lots of them anyway. Some of them I'm also getting to know them gradually, but then at the end of the day, some of these factors do not solely lead to infertility as a whole, and some of the issues that are available are treatable. If one comes to the hospital, there is always a better solution to this problem.
So you said like one of the myths that like sex positions also contribute to. It's not like a myth, but it also contributes.
Yes. Most of the times when someone else's or cervix is innervated or the position of the cervix is not centrally, sometimes we might even advise people to do a bit of different sexual styles, so that there is a proper insertion of the semen into the cervix.
Yes.
Yeah.
So when you talk about infertility, what are the most important treatments that a person can receive?
All right, fine. So there are surgical treatments. Yeah, sometimes people might be, the endometrium might also be scraped off a bit, just to make sure that a fresh endometrium is provided, and then it grows on its own, and then there's a proper conducive environment for an implantation of the fetus. There is also the medications. We have some medications that boost fertility both in male and female. They might encourage the growth of the spermatozoa, like the fertile 40. Then we've got the drugs like clomiphene that also provide a conducive environment for ovulation to take place. So at the end of the day, one may reproduce, if at all. One of the factors that were contributing to infertility is in ovulation. And we also have the other procedures like in vitro fertilization. In short, it's just called IVF.
Yes.
As I already stipulated that it's not actually conducted in Malawi, but South Africa I think is doing it. It's also one of the procedures that have proven to be very effective. So this is a procedure whereby a woman is provided with some medications that will encourage ovulation, and then later on that ovule, when that ovule has been produced, it's collected in an agar, and then later on it's mixed together with the spermatozoa. So when that fertilization has taken place, that blastocyst or the fertilized ovule that was produced, that was implanted in the agar, is later on transplanted back into the uterus of the woman. So later on they have to test that woman for pregnancy. If it comes out positive, that means that woman is now pregnant, and then later on they continuously monitor her to make sure that the growth of the baby is provided with extra care. Yeah. So basically, it's a very expensive procedure. Actually, it's not a procedure that you might consider that will be done to each and every individual that is experiencing infertility, but it's also one of the solutions that is provided to us now.
What are some of the options for same-sex couples or single women who want to conceive?
All right, so one of them is the in vitro fertilization. I think that is also
The best
especially that is one of the first options, especially to those women. And the second one is an adoption. Adoption is also one of the factors. apparently we have lots and lots of orphans. So if one is provided with a little baby and growing up with them, later on it also feels like you're part and parcel of them in their lives. Yeah. But for men, the only option is just for same-sex couples, like especially men. The only option is adoption, because we don't actually have that organs in our system that can harbor an embryo, and then later on putting it to growth cannot happen.
What are the next steps for couples who have tried to conceive but nothing has worked permanently?
As I already said, if they come about and then visit our clinic, most of the times we expect to provide some counseling, and then we also provide with them those options, the adoption options, the IVF options, and if at all we've tried our best and we have seen that nothing else is happening, then counseling is the best option for it, because most of the times these couples really need counseling for their relationships to go on. Otherwise, we have seen people doing lots and lots of funny stuff just to make sure that they attract attention.
This marks the end of our today's podcast, where we have heard from our renowned doctor, Dr. Jennings, telling us more about infertility, the factors, the myths, and the latest advancement called the In Vitro Fertilization. Thank you very much for listening. Until next time.